Hi everybody, my name is Hester. I am bringing you a video today just to give you an update on the changes for Discovery Health for 2021. Hopefully this will be a short and sweet video that will just keep you up to date. Starting with the premium increase, you've probably already heard the good news that the premiums have been frozen for the first half of next year. And then they will announce what the premiums are going to be closer to the time, but we've been promised that it won't be more than 5.9%, and that will be across all plans. So the focus changes that I want to concentrate on for 2021 is the Discovery Connected Care, Centres of Network, and also Sharia compliance. Looking at Discovery Connected Care, this is an ongoing developing digital solution where Discovery have always been excellent in sharing or making this ecosystem for the patient or the member, where information from your wearable device can be shared with your doctor, with your GP, or specialist, the pharmacy even, and they can all look at each other's input into your health care system. And what they've done is they've advanced that even more now with the use of a diagnostic virtual consultation tool that will allow the doctor to e-script and also have your medicine delivered irrespective of the time of day. Discovery believe that COVID have taught them that home is a safer place to have your consultations. So you can use this system. Right, so introducing TytoCare. You would buy this hardware. It's a main system that has excellent sound and image quality to give the doctor the best possible information that he needs for his diagnosis. There's an otoscope that goes into your ear, a stethoscope so you can have a listen to your lungs and heart, and then finally a tongue depressor. Now, I'm not expecting everyone to rush out and buy TytoCare, but I do think that this would be very, very useful for some patients who have a high incidence or a high risk of getting infections. So as I said, it's available 24/7. It gives you an accurate diagnosis. The doctor will give you a script. He'll also do a sick note for you if you need to have that done. Your electronic health record would then be available on the ecosystem, so your GP can go and have a look and see what has been diagnosed and treatment that's been given, and also any relevant referrals that may have been given. And this would be at the cost of a normal consultation through your medical savings account. So for those members of Discovery Health or Discovery other products on Discovery, the price is $6,284, and then for the non-Discovery clients is $7,855 for them just to get the user kit. The Centres of Network are already in existence. There are 2 of them for major joints and psychiatric in-hospital network. And the whole point behind this is that Discovery have amassed a lot of data where they know which doctors are particularly good at dealing with these conditions and have a higher rate of resolution or treatment. So in addition to that, the network has been expanded to deal with colorectal cancer. These are generally surgeons. Again, as I said, that have a really great track record, and you'll know who those individuals are. And then finally, the spinal care. Sharia compliance has not been made available on Discovery Medical Aid previously. For those Muslim clients who would prefer to be Sharia compliant, as an existing member, you just need to let Discovery know. If you don't let them know, you will stay on the normal option. And for new members who join Discovery, you will be able to select an option, a box that says that you want to be Sharia compliant. Let's have a look at the changes to the plans that I think are important that I would like you to be aware of. The first one is for infertility and what they're calling ART, which is assisted reproductive therapy. There are 4 main segments of this infertility program. It's IVF, which has been around for a long time, intrauterine insemination, FET for those that have had their embryos frozen, and then lastly ICSI. I honestly didn't have a cooking clue what this was. I had to look it up. It's intracytoplasmic sperm injection, where they actually use a microneedle to inject sperm directly into an egg and thereby form an embryo. It's only available for those members who are on comprehensive and executive plans, and you must have been on those plans for 2 years or more. They will pay for 2 cycles, and the cost of it is $110,000 per person per year. There will be a 25% copay that will form part of this treatment, and if there are costs over and above this Discovery Health rate, those would also be for your pocket. I still have to double check on all the gap covers to see that they would cover this, and that infertility is not a specific exclusion. So just be careful of that. Lastly, females only from ages 25 to 42 would qualify. The diabetes program has been around for a long time, but it's now going to fall under the Discovery Care Connect and that network of premium doctors that I was talking about. And for the first time, comprehensive plans have also been asked to use the network specifically for diabetes. If you also have cardiac care, the one doctor that you've nominated would look after both of these conditions for you, so that you're getting a coordinated care through a single doctor who has shown clinical success in this area. So for you, this is a good thing as a patient. Endoscopic procedures such as gastroscopes or colonoscopies, things like that. There have always been co-pays for in-hospital, and that will continue of $5,600 or $6,200 depending on your plan. There is going to be, for the first time, a reduced co-payment for the use of a daycare center or a daycare clinic of $3,650. And if you have your gastroscope done with the doctors or in an endoscopic suite that the doctor is using, there would be no co-payment as per normal. If you're using a daycare clinic that is not within the designated service provider, so it's not in the network of Discovery, there will be a penalty that would be applied, and then depending on which is higher, the copay or the penalty is the one that would be applied to the procedure. Finally, where you're having, unfortunately, a colonoscopy and a gastroscopy together, the higher copayment will apply. So there's just a little change there to the endoscopic procedures. Hospital networks, we've been informed that there are some additions and some deletions. So for the hospital networks being used through the Delta network, Smart and also KeyCare, please just check that you're aware of any changes to the network. Copays for 2021 and deductibles will increase by 3.5 and 4%. So these are the normal copays and deductibles that would be applied. Normally your benefit limits would increase at the same rate, but they're not because of COVID and the price freeze on the premium. So they're only going to go up by 3%, with the exception of oncology, specialized meds and technology benefit, your international travel benefit, your overseas treatment, and also KeyCare mobility, where there will not be an increase for 2021. And then finally, for those who have plans that have a threshold benefit, such as priority, comprehensive, and executive, those threshold benefits will go up by 4%. There has always been a mental well-being program, but it's been confined to PMB or prescribed minimum benefits only. So it's the relapse, so they've just expanded it a tiny little bit, which might give a few other people an in to being able to be accepted on the mental well-being program. They also know, they're telling us that after being hospitalized for a mental episode, the first 30 days are the worst, where you are likely to have a relapse. So they have put a program in place to support those that have been discharged from hospital. Also an enhanced outpatient care program. mental health patients will have free access to personal health goals on Vitality. And then, as I said, a slightly expanded access. So where you've had episodic depression over the last 12 months, you can be considered for enrollment into this program, which would be great. Here's just a quick picture of your Vitality app on your smartphone. It looks at health checks, healthy food, mental well-being programs and support applications, and then finally your fitness ring. So if you achieve your goals, fitness goals for the week, you will close your ring and have a play on the game store, on the game board. So we also know that if you have more focused goals and you have you get moving and start getting fitter, this is a huge help in terms of being mentally unwell. Finally, we're looking at the Discovery Prepaid Health. So we know that many people, they say 50% of South Africans, do not have medical aid or don't have a way of seeing a private GP as a standard. We also know that by going to see a doctor, going to see a GP when you're not well, you are far likely to get well better because they're going to prescribe the right medication and give you the right advice. On average, a GP consultation nowadays is 442, and by using the health vouchers, you are going to get a discounted price with the network. And then finally, in most instances, people who don't have medical aid or who need to go and see a doctor and can't fund it themselves, or it will be funded by a family member or by an employer. I do think that there are other, perhaps better ways of funding employer health options, and I'd be happy to discuss that with anyone, and it's not necessarily through a medical aid either. Right, so there are a lot of people who need help, who need to see GPs, but they don't necessarily have the money at the time. So this could also be used, by the way, for someone who's on a hospital plan and doesn't want the extra expense of in and out of hospital, and they would also be able to use these prepaid vouchers. All right, so it's a simple, intuitive digital vouchering solution that you can purchase whatever voucher it is that you need, and you can share a variety of accessible healthcare services at a significantly discounted rate within the wide distribution network. And a free-to-use digital platform as well. It's going to be available from 1 December, and then depending on what voucher you want to buy, you can select which one, and it would cost various different prices. They will always include medicine. Okay, so you can get it from leading pharmacies, and you can also get it from GP practices. Thank you guys for spending this time with me. I hope I've informed you of all the applicable changes. If you do need to get a review done, now is the time to do it. Please contact me as soon as you can, because there's usually a rush for everyone to have their medical aid reviewed at this time of the year. And it won't necessarily just be an upgrade, it could also be a downgrade. It could be that you are on a plan that is just too comprehensive for your needs right now, and we can save you some money. I always say you only get married to your medical aid for 1 year, after which you can swap out. Right, so please contact me at Wilkinson Insurance, or you can book an appointment, real or virtual, by contacting me. All my details will be on this email. So that's me for now. Thanks very much, and take care.